Ladies and gentlemen, welcome to the third session of Diabetes Day at Health and Wellness Campaign, online health awareness talk brought to you by ASEAN Medical Student Association, University Putra Malaysia. It is a pleasure meeting all of you. The ceremony will commence shortly. Before we begin the talk session, here are a few important announcements and we hope for your attention. Dear audience, their QR codes and Google Form link will be provided at the end of the talk. Please fill in within 15 minutes to record your attendance. If you have any question during the talk, feel free to type it down at the Slido link provided in the YouTube live chat box. Our speaker will answer your question during the Q&A session. Please like and give us some reaction throughout the talk to show your support towards our speaker today. You do not need to put your name and metric number in the YouTube live chat. Also, please follow and subscribe us at Amsa UPM social media accounts as mentioned in the chat box. Your cooperation is much appreciated. A very good day to everyone. We proudly welcome you to Diabetes Day at Health and Wellness Campaign 2022 online health awareness talk session 3 organized by ASEAN Medical Student Association AMSA UPM. Greeting I bid to the honorable speaker for today's session, Dr. Tan Ming Yeong, and also to the beloved participants. The ASEAN Medical Student Association of UPM, or AMSA UPM, is back with another February session, Health Awareness Street Talk Show, as we going into the dimension of diabetes care, the role of the diabetes educator. Before we begin today's session, let me welcome Muhammad Shahril bin Muhammad Saneb to recite the dua. May our session will be blessed.
Bismillahirrahmanirrahim. Allahumma ya Allah. On this blessed morning, in conjunction with the Health Awareness Talk Session 3, we beseech thee and grateful towards you in favor of all the infinite blessing to us, your humble servant, to life in safe and prosperous life. We seek your blessing for a flawless progress of this event from the beginning. Seek your guidance to steer clear of event that will detrimental the progress of this event. Ya Latif, Ya Rahman, please bless us with your taufiq and hidayat. Please guide University Putra Malaysia to greatness, peace, glory and prosperity in this world and the hereafter. Make us a responsible intellectual. Grant us with a valuable knowledge that will be beneficial to mankind in order to gain your mardatillah. Make us your righteous servant that followed your commands and neglect the sinful act. Please forgive us for our wrongdoing. ربنا عليك توكلنا وإليك أنبنا وإليك المصير. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. وصلى الله على سيدنا محمد وعلى آله وأصحابه وسلم والحمد لله رب العالمين.
Thank you to Muhammad Shahril bin Muhammad Saneb for his prayer recitation. Now, allow me to explain about the flow of this session to all of you. This program will be kicked off with the energetic and yet informative talk from the Honorable Speaker, Dr. Tan Min Yong. Without further delay, let us go into the session. Before that, let's enjoy an exciting promotional video about the ASEAN Medical Student Association.
Asian Medical Students Association Malaysia is the most far-reaching and the oldest Malaysian Medical Students Association established in 1983. Amsa Malaysia has nurtured future doctors to be to disseminate knowledge, undertake creative vocations, conduct community services, and foster new friendships. Now, AMSA Malaysia has blossomed into a member-based, non-profitable, non-sectarian, and non-political organization. With friends and members present countrywide, AMSA Malaysia has new offshoots budding, which are public relations and alumni, academics and research, multimedia and publicity, public health, and the Asian Medical Students Exchange Program, AMSEP. The fundamentals rooting AMSA Malaysia for its sustenance to this day are knowledge, action, and friendship. Follow us on our social media at Facebook and Instagram. Stay tuned to AMSA Malaysia. Viva AMSA, building bridges, sharing dreams.
Now, let us get to know more about our speaker of this session. Dr. Tan Ming Yeong is a senior lecturer in the School of Health Science, International Medical University, Malaysia. This dedicated lecturer is also a diabetes nurse specialist in International Medical University, Malaysia. Dr. Tan Ming Yeong is also credentialed diabetes educator from Australia Diabetes Educator Association. In this session, our speaker, Dr. Tan Ming Yeong, will mainly share with us about the role of diabetes educator. If participants have any question during Dr. Tan Ming Yeong talk, feel free to drop your question at the Slido link provided in the chat box during the Q&A session. So, now let us all welcome our honorable speaker of this event, Dr. Tan Ming Yeong.
Good morning. Can you all hear me?
Yes,
Okay, great. Can I have my slide, please? Thank you very much. First of all, I would like to thank the organizing committee for the invitation and our chairperson for the kind introduction. I've been a diabetes educator for the last 35 years. So I feel very honored to be able to be invited by your organization to share my experience of my 35 years journey. Next slide, please. For my talk, before I speak on the roles of diabetes educators, I think it is good to share with you what are the situation of diabetes globally and in Malaysia. What are the principles of diabetes management? Why is diabetes education so important? And lastly, who can be diabetes educator? Next slide, please. Since we can't see each other with the COVID pandemic, I would like to get to know you a little bit better. So I have a few Slido questions for you. My first question is, are you acquainted with any person with diabetes? There are three answers. One is yourself, yes, one is no, and one is not sure. I will invite you to participate in these Slido questions. give a few minutes, then I would love to see your response. Great, there are 7 people has responded. I'm sure there are more than 7 of you in the audience now. Maybe we'll wait a short while more. We'll wait until about 15 respondents, then great. So I can see that most of you are not acquainted with persons with diabetes. Acquainted, that means you know someone with diabetes. It's great. Thank you very much. Oh, now it's half-half. Thank you very much. Can I have the next slide, please? Now, my second question for Slido is, globally, how many people live with diabetes in 2021? Wow, that was great. Very good. Very fast response. Thank you very much. Most of you say that it's 537, and some say that is 537 is the maximum, 50% respondent. Great, thank you very much. Can I have the next slide, please? Yeah, you're right. Oh, you are very good. The International Diabetes Federation Atlas in 2021 said that there are 537 million people with diabetes globally. Now, just to give you a little bit background on the International Diabetes Federation, is a NGO for diabetes globally. Every few years, you will have an international meeting, great meeting. I attended many of them, and in fact, the 2021 Atlas is the 10th Atlas for IDF. As you can see also, in the year 2000, in 21 years, the prevalence of diabetes globally has increased to 386 million. So diabetes is reaching the pandemic. Next slide, please. Next slide, please. Great. So that is global figures. Wow, we already have the answer. I hope you all are familiar with the National Health and Mobility Survey. My question is, based on the 2019 National Health and Mobility Survey, 1 in X people in Malaysia more than 18 years old has diabetes. So what is the X number? Well, many of you say 1 in 10. Great. Now 9 participants. Okay, that is very good. Thank you for your participation, for your view. Can I have the next slide, please? Now, based on our National Health and Mobility Survey 2019, diabetes in Malaysia is 1 in 5 adults in Malaysia have diabetes. And these 1 in 5 are people aged 18 years and above. And I believe the participants of today, the audience of today, they are above 18 years old. So there are about 3.9 million people with diabetes. For those who may not be familiar with our National Health and Mobility Survey, our Ministry of Health, Malaysian Ministry of Health, have excellent data collection. This National Health and Mobility Survey was started in the early 2000, if I'm not mistaken. And initially, it is an NCD department of the Ministry of Health. They want to know what are the health status of Malaysia? So diabetes is one of the NCD non-communicable diseases. So every time they will show you how many percent of our people have diabetes, have hypertension, have high cholesterol, had mental illness, malnutrition, and so on. Initially, it was done every 5 years, nationwide survey. But since the early 2010, we have to do it every 4 yearly because our prevalence of diabetes has gone up so fast. Next slide, please. As you can see in this slide, 2011, we only have 11.2% prevalence of diabetes. 2019, it has increased to 18.3. In fact, 2015, it was also 1 in 5 Malaysians has diabetes, but the age was 30 years old and above. But 2019, the age is more than 18 years and above. That means people with Malaysian are getting diabetes at a much younger age now. Next slide, please. The worrying situation in Malaysia is, in fact, it is, I would say in Malaysia, since the day I started my diabetes education training in 1987. We already know, if you know somebody with diabetes, there is somebody else walking around that do not know that he or she has diabetes. As you can see, one known and one unknown. If you look at the chart, there is on the right-hand side, the yellow bar is the one that the person with a raised blood sugar do not know that he has diabetes. It's almost equal to a known diabetes, because diabetes, many times 50% of the people with diabetes, they do not have any symptom. When you have no symptom, you don't go and see the doctor, you go for screening, you will not know until something happened to you. Next slide, please. So now, if a person with diabetes, so what? Next slide, please. Many of my patients will tell me, well, I get diabetes, I go and see the doctor, I take the medication that the doctor give it to me. Is that all? Is taking medication alone sufficient in taking care of a person's diabetes? Next slide, please. Now, managing diabetes. Diabetes is a lifelong disease. Just like hypertension, cholesterol, they are all lifelong disease. Diabetes management is 24 hours a day, 7 days a week, 52 weeks a year, no holiday. And people with diabetes and their caregivers, they spend less than 5% of their life within the healthcare system. The environment, that means they go and see the doctor, they are in the hospital, in the clinic. The rest of the time, it is they themselves taking care of their diabetes. I will explain this further to you. Next slide, please. Why do I say that? Let's put in some mathematics calculation. If a person with diabetes visit their doctor, as earlier as what I mentioned, a lot of patients would tell me, I go and visit the doctor every 3 to 4 months. So it's 4 times a year. Each visit, they spend about 15 to 30 minutes with their doctor. Well, if in the public healthcare system, it might be less than that. Then, if I calculate that, it will be 1 to 2 hours a year. If the person with diabetes, if they are lucky, they manage to consult a diabetes nurse or dietitian or a pharmacy 2 to 3 times a year. Each time is about 1 hour. that is usually we need to spend that time with our patient. So that is 2 to 6 hours a year. And the rest of the life, the person with diabetes decide how to take care of their diabetes. That means if this weekend, tomorrow you have a kanduri to attend, how do you manage your diabetes? If now your house is flooded, how do you manage with your diabetes? That's why we say 95 to 98% of the life of a person with diabetes decide their own diabetes care. So daily diabetes care is primarily self-directed. You decide what you need to do. Next slide, please. Taking care of diabetes is not just taking medicine. It's 8,760 hours a year. As you can see from this slide, besides taking medicine, you have to monitor the blood sugar. If you are very big size, you need to lose weight. You not only need to attend your doctor's appointment, you also need to screen every year, have the healthcare provider check your feet, check your eye, and every day you need to take care of your diet. You should exercise regularly. And not only monitor your blood sugar, it is also important to monitor your blood pressure. If you just take care of your diabetes, you don't take care of your blood pressure, you are in trouble too. And of course, body weight. If you are a smoker, you have to consider quit smoking because that will definitely increase the morbidity and mortality of diabetes complication. Next slide, please. So the aims of diabetes management is to achieve optimum health. As medical student, when you graduate as a doctor, this is your aims of diabetes management. Help your patient to achieve optimum health and minimize diabetes-related complications, which I will elaborate in the following slide. Achieve good quality of life as desired by the individuals with diabetes. That is very important. If you just take care of your diabetes, what we expect the patient to take care of the diabetes, we also have to ensure our negotiation with the patient is what the patient want to do, especially for the elderly. And with all this, of course, we need to reduce healthcare costs for the patient, for the family, for the community, for the country. Next slide, please. Now, this is diabetes complication. I'm not sure whether you are aware of it or not. Very important. Diabetes complication does not care who you are. It is regardless of race, it's regardless of gender, it's regardless of socio-economic status. It can affect anybody. It is from the top. People with diabetes have 4 times higher chance of getting stroke as compared with a person without diabetes. Your teeth, even your teeth is affected because when your sugar is very high, it can cause gum infection. If you get a tooth decay, it is more serious than a person without diabetes. If you come down on the right-hand side, if you can follow me, cardiovascular disease. People with diabetes has minimum 2 to 4 times more chances of getting cardiovascular disease. It is not just myocardial infarction. It includes heart failure. Out of 10 people with diabetes, out of 10 people having heart failure, 4 are people with diabetes. And then if you move down clockwise, you have the diabetic neuropathy. That means the nerve. That is why people with diabetes have 15 times higher chances of getting leg amputation. In fact, the leg amputation, if you move on the foot ulcer, because when you do not sense, you get an ulcer, you get an open wound, you do not know. If you do not check, this is where diabetes education, the role of diabetes educator come in. Then, in fact, amputation in this world, 85% are because of diabetes. So it is very important. People with diabetes should go for their annual fit assessment regularly. Then if you move clockwise, I put down there pregnancy. Now, during pregnancy, the person with diabetes the lady will have a lot to do. She must keep her blood sugar as near normal as possible. The blood sugar value is different from people who are non-pregnant. Otherwise, you will end up with a lot of complications related to diabetes during pregnancy, not only to the mother, but to the fetus, the baby. They can end up with big baby. They can end up with complications of big baby. And this is not only for ladies who have diabetes. There's another group, what you call gestational diabetes. In case some of you who are not familiar, that means you only get diabetes during pregnancy. For the ladies with gestational diabetes, equally same, you have to take care of the blood sugar level. And why we call it pregnancy? Because if you deliver a baby girl, and this baby girl grow up, her chances of diabetes is the same. It's also higher. If she deliver another baby girl, then diabetes will transfer from one generation to the second generation to the third generation. This is what we call transgeneration dissemination of diabetes. If you move up some more, diabetic nephropathy. If you visit the dialysis center that is all over the country, currently 10 people who sit in the dialysis center, 7 of them are due to diabetes because of the prolonged inadequate control of blood sugar. They land themselves in the dialysis center. And we hope in overseas, in other countries, a lot of them are only 5 out of 10. But Malaysia, kita boleh, is 7 out of 10 according to the latest data. And if I move upward again, I hope you are following me, is diabetic retinopathy. Now, diabetes is one of the most common cause of adult blindness. Diabetes affects the blood vessel in the eye and affects the eye that can cause blindness. So we as healthcare providers need to inform our patient to prevent diabetes complication, which is possible. A lot of people have done it. Minimize complication. If they ever have complication, to delay the progression of diabetes complication. That is also possible. As research has shown it, all these are possible. As I said, we need our patient with diabetes to be educated, to be willing to cooperate, to take care of their diabetes. Next slide, please. Now, it is essential for people with diabetes and their caregiver. Why caregiver? Because people with diabetes do not live alone. They live in a family. They live with friends. They live with colleagues at work. They are all should be equipped with the necessary, not just knowledge. Knowledge does not change behavior. Technical and problem-solving skill. Why technical? Because people with diabetes will need to monitor their blood sugar, their blood pressure. And now you have newer technology in monitoring blood sugar. And then you need a problem-solving skill, like just now as I mentioned. People with diabetes have to look after themselves. If you have low sugar, what do? If I have to go on a long trip, now let's say COVID go away, we can go and visit Europe, we can go and visit America or anywhere. During the long flight, if you are on insulin injection, how do you solve the problem? That's why you need a problem-solving skill. And even with the knowledge, technical and problem-solving skill, if you do not have the correct attitude to self-manage your condition, you are not going to do well. Correct attitude is very important. Correct attitude means the person wants to improve their own condition, prevent, minimize diabetes complication. So all these have to go through education. Education can be individual, it can be in a group. It does not matter, but education. Next slide, please. So now I come to diabetes self-management, education, and support. What are the objectives? Why do we say education and support? Have you ever wondered? Because education does not come once, and support in between when the patient or the people with diabetes have problems. We in the medical team should be able to provide them with some support. So our main objective is to empower self-care behavior. The person have to do it themselves, or the caregiver have to help to do it themselves. Empower them. Facilitate problem-solving skill. If now, today, this weekend, I plan to go for a hiking trip. So if you're on medication that can lower your blood sugar, if you're on insulin that can lower your blood sugar, what do? There is problem-solving skill. We need to facilitate them how to solve the problem. Support them with informed decision making, because the final decision is the people with diabetes and their family member, and we support them. And meanwhile, we also encourage collaboration of these people with diabetes and their caregiver with the healthcare team, so that we can work together to ensure to improve their clinical outcome, their health status, and the quality of life. Next slide, please. This is the American Association of Diabetes Educator 7 self-care behavior. This self-care 7 AADE self-care behavior was started by the American Association of Diabetes Educator. They have changed their name to American Association of Diabetes Care and Education Specialists. Since 2003, they introduced this because they believe if a person lives with diabetes, you have to do all this to achieve your clinical outcome, to achieve your quality of life. Diabetes, if you can remember, it involves healthy eating, being active, and exercise, of course, monitoring of blood sugar, blood pressure, body weight, regularly take their medication, because research has shown that out of 10 people with diabetes, only 6 of them take their medication. Problem-solving skill, healthy coping, and reducing risk, reducing the complication. Next slide, please. Now, it was started in 2003, but in 2020, they have a revised AD7 cell care. As you can see on the left-hand side, previously it was listed. That means it just lists down the number. But now they have put them into a green on the right-hand side, because they believe, because AD7 cell care is evidence-based, there is a lot of research done on it, they know that it works. And they believe that healthy coping is the most important of all. If a person with diabetes are not coping well emotionally, if they have a lot of anxiety, if they have depression, they won't take care of their diabetes. So healthy coping is the most important, that is in the middle of the ring. Then the next ring is where you need to do every day. Take your medicine, eating healthily, and being active. By doing that, then you go to monitor to see your blood sugar, your blood pressure, your body weight, to see what you are doing every day, does it work? By that, then you can help to problem solve your problem and reduce the risk of diabetes complication. So it has changed from just listing it on the left-hand side to a ring now. Next slide, please. Now, another thing, this is also adapted from PPRI in 2012 that was published in Diabetes Educator journal. Diabetes education is not that you gather a group of people with diabetes and the caregiver and start giving education. That is called immediate learning. I teach you now, you know. But all this learning since 1988, Professor Sharon Brown has already mentioned, knowledge does not change behavior. We need the patient an intermediate diabetes outcome to change their behavior in healthy eating, being active, taking their medication, monitor their blood sugar, blood pressure, and so on, problem solving, healthy coping, and reducing risk. Then only you can move another step. Then you can see that it improves clinical outcome by measuring their HbA1c, blood pressure, lipid, weight, ISM, and so on. For long-term diabetes cell management education outcome is to improve health status, their overall health, their quality of life, their day loss from work or school, and diabetes complication and healthcare costs. Next slide, please. Now, how effective is diabetes education? Is the efficacy of diabetes education sustainable? That is important. Next slide, please. Now, this is a meta-analysis that was published in 2002. Meta-analysis, that means they gather a number of research to look statistically to see whether it is effective. On effect of diabetes cell management education on blood glucose control is published by Susan Norris and the team. And it showed that diabetes education is effective. Next slide, please. From the last slide of my meta-analysis, it says that definite evidence of the efficacy of diabetes cell management education. Improve blood sugar control by reduction of 0.76% in HbA1c. So for those who may not be familiar in diabetes management, how we measure our diabetes control is measuring the HbA1c every 3 to 4 months. It is the average of blood sugar control in the last 3 to 4 months. Improved blood sugar is associated with the duration of education contact. It required 26.3 contact hours to reduce 1% of HbA1c. And in 2002, Susan Norris, in her meta-analysis, she reported effectiveness of diabetes education diminished over time. Only 6 months. After that, it seems it doesn't work that well. Next slide, please. In the recent meta-analysis or systematic review by Carroll and et al., they have shown that diabetes education is effective. As you can see in this slide, that they have included 118 RCT randomized control trial with almost 12,000 subjects. And diabetes education can be reduced on a mean of 0.57%, whichever glycemic status you are in. The higher your glycemic control initially, more than 9 days on the right-hand side, the better the control is. Next slide, please. Susan Norris in 2002 said that diabetes education effectiveness, efficacy diminished after 6 months, but not in the recent paper. It has shown that even more than 12 months, it is still effective. That is very important finding. That means diabetes education is effective even at a longer period. Next slide, please. So some of you may wonder, so what? But the HbA1c reduction is only 0.76, 0.59. Is it a big deal? Now, if you look at this is published by British Medical Journal in 2000. This is a study done by United Kingdom Prospective Diabetes Study. They show that every 1% reduction of HbA1c, you reduce the death from diabetes. I'm sorry, it's sort of turning it upside down. It's minus 21%. Fatal and non-fatal heart attack is minus 14%. Microvascular complication, that means the kidney and the eye, is less by 37%. Periphery vascular disorder that means there is a foot ulcer, is reduced by 43%. Fatal and non-fatal stroke is by 12% and heart failure by 16%. I apologize. I don't know what happened to the slide. It sort of turned it upside down. Next slide, please. So now we come to the roles of diabetes educator. I've given you a background how important diabetes management and education is. So the main role of diabetes educator is to promote optimum health and well-being for the individuals with diabetes, community, and population at risk of diabetes. Because now we are also targeting at the pre-diabetes and all those affected by or diabetes, using a range of specialized knowledge and skill. We need to integrate this diabetes self-management education together with the clinical care and work as a diabetes team. We don't work alone. We work as a team to promote physical, social, spiritual, psychological well-being. And that is the wellness definition by WHO. Next slide, please. So the role of diabetes educator, I put them into 8 of them. The main one is to provide education, counseling, and motivation, and clinical management. Those are the 3 most important. and collaborative care with the team, administration, management, and leadership, mentorship, professional development, and research. I will elaborate each of them in the following slide. Next slide, please. I'll elaborate the role of diabetes educator in a scenario of my patient. Mr. Lee is 50 years old, businessman, diabetes long time. You can see he's obese, sugar high, blood pressure high, cholesterol high, everything high, and he's already in kidney failure, and he continued to smoke a pack a day. Next slide, please. So for Mr. Lee, it is important as diabetes educator, we provide education to ensure that he has the knowledge, technical skill, problem-solving skill. He can cope. He's a businessman who travels. He can cope when he is on insulin injection, he is on medication during his travel. He can cope when he go on exercise and how to reduce risk. So we enable Mr. Lee to manage his diabetes-related health to the best of his own ability. That is very important. We provide him with education. Next slide, please. Is counseling and motivation. We as healthcare professionals always expect people with diabetes, they have to be obedient, actively participate in their care, and cooperate with the medical team. But in real situation, sorry, that is not the case. And why? Next slide, please. Because life has many events other than diabetes. As you can see, recently we have a very bad flood in Malaysia and sometimes stressful event in the traffic jam. And we have a lot of fruit season, durian season. So what do? Life is full of temptation. McDonald's, KFC is everywhere. And work is stressful. So it is not as easy as what you just tell the patient what to do. You got to work with them. Next slide, please. As you can see, we have to advise Mr. Lee to achieve his glycemic control as low as possible. Otherwise, his chances of getting myocardial infarction, the higher the HbA1c, that means the glycemic sugar, the higher the chances of myocardial infarction. The higher the blood sugar control, the higher chance of getting microvascular disease, that is kidney failure and blindness. So that is very, very important. Next slide, please. So does it mean everybody at risk of complication? No. Those with persistent high blood sugar, persistent high blood pressure, persistent high cholesterol, those who are big, especially abdominal obesity, and those who still continue to smoke. Nothing will change them if they don't continue doing this. So we have to empower Mr. Lee to understand his own risk of diabetes complication, and then encourage him to take his own self-care. Next slide, please. Counseling and motivation. Now, we have to use empowerment theory. That's why in diabetes educator training curriculum, we put in a lot of behavior science. We have to empower Mr. Lee to develop his own self-care ability. You may not be able to do everything at one go, but you do step by step. Use empathetic, active listening to clarify his health belief, issues, and concern. You must listen to the patient. and not dominate the whole consultation session with your so-called advice. Patient may have reason not to take their medicine. Patient may have reason of because of some health belief, the friend says so, and the family member had problem, and so on. So we must listen, practice active listening, allow the patient to voice out their concern of why they are not doing that. Then you come to a conclusion. You can provide them with education, come to a conclusion that is acceptable by both Mr. Lee and yourself. Next slide, please. Clinical management. Now, diabetes is not just talking, educators' role is not just talking about what they need to do. We have to provide direct clinical care and intervention to Mr. Lee based on your own professional scope. Are you a dietitian? Are you a pharmacy? Are you a medical doctor? Are you a nurse? And so on. We have to include assessment that we have done with Mr. Lee, come together, plan and management care pathway for them, therapeutic intervention, what are the medications that need to be changed, and then annual complication screening, what he needs to do annually to screen for presence of complication. And all this has to be evidence-based clinical practice. And in Malaysia, the MEMS, the metabolic society, the endocrinology society, that every 3-4 years they'll come out with a CBG for management of type 2 diabetes. Now they have CBG for type 1 diabetes, for gestational diabetes too. So everything has to be evidence-based practice. Next slide, please. Very important, it is not us who take care of diabetes. It has to be managed by a team. So the collaboration with the interdisciplinary healthcare team by appropriate referral. That means next time if you graduated from a medical school, you are a doctor, you should refer to your diabetes educator, dietitian, physiotherapist, pharmacist, clinical psychologist, and social worker. Why are all then important? People with diabetes, as mentioned earlier in the AAD 7-cell care, now healthy coping is most important. If you think they have a lot of emotional problem, they have a lot of anxiety and depression, you need to refer to clinical psychologists. If you think they have social problem, psychosocial problem, not able to support a lot of things, you can refer to social worker. And it should be a timely referral. Don't refer when the patient is already having a lot of complication. It should refer early. And among the team, we need to have a regular communication with documentation to share the diabetes care plan and progress of Mr. Lee. We need to speak the same language or common goal. Just to give you an example, if the doctor tells Mr. Lee, well, your fasting blood sugar, your target is 8, I would not agree. I think Mr. Lee target fasting blood sugar should be 7 and less. So we got to communicate among the team. Otherwise, Mr. Lee will get very confused with the message that we are trying to pass to him. And everything should be patient-centered care that involve Mr. Lee in the decision making. Don't leave them out. Even if they are elderly, they want also to be part of the team. Next slide, please. Administration, management, and leadership. Remember, you don't work alone. You got to document Mr. Lee's care in his medical record, whether it's a physical medical record or electronic medical record. That is administration work. Manage your department budget and service planning. Because you are working in a department, you have to manage all this. You can also act as a resource personnel to your colleague. contribute to planning, develop diabetes care policy when you have undergone specialized training in diabetes and procedure for diabetes services. Like in the last 1 year, I have introduced some new services related to care of people with diabetes in both in IMU Healthcare Clinic and Malacca Oriental Hospital. So if you are trained, ensure services provided meet the recognized standards for professional, ethical, human resources, organization and business practice, and the community needs. What do your community needs? Very important, because diabetes care is a chronic care model. Next slide, please. Next slide, please. Mentorship. If Mr. Lee is managed in an established diabetes unit with a diabetes team, the senior diabetes educator can act as a role model. Just like next time when you graduate as a doctor, in where you work, they always have this mentorship for you. A junior doctor will tag along with a senior doctor. As expert in diabetes education and care, like myself, diabetes as a credentialed diabetes educator, I help to assist to develop and provide training and continuing professional development for a wide range of healthcare providers in a variety of setting and level. Like now, I'm giving you all a talk about diabetes educator. You can do it in your own local setting. You can do it in many, many different levels. The senior diabetes educator can also help other healthcare providers working towards certification in diabetes self-management education. Like I guided my nurses, I guided the other healthcare provider how to assess their certification to become a diabetes educator. Next slide, please. Now, professional development. Learning is lifelong. It's not that when you reach 80 years old, you don't learn. Diabetes educator, we assume our own responsibility for professional development. That is very important because knowledge change, skill change, many things changes. So we have to make sure we are updated with the latest development in diabetes management and education. And continuing education to maintain and update knowledge and skill so that we can facilitate this diabetes education and care for Mr. Lee's case. Very important. When we care for him, we don't use the knowledge that we have, the skill that we have that is 20 years ago. When you update your knowledge, you share your knowledge with your patient, and in this case, is Mr. Lee. Next slide, please. Research. In the paradigm of evidence-based method, diabetes education should be evidence-based, and AADE 7 cell care is evidence-based. Research helps us, diabetes educator, to validate our clinical practices. Example, standard of care. Now, in monitoring, we have continuous glucose monitoring, we have insulin pump. So, whatever we introduce, it has to be validated clinical practice. It has to be according to the standard of care. Diabetes educator, we can also conduct research activities. There are many diabetes educators who conduct research activity, especially abroad, but some locally also. so that we can apply this research finding to enhance our practices and care for Mr. Lee. That is very important. And diabetes educator training curriculum usually include research as a core subject because there is a lot of publication. Can you trust the finding? That is where, as diabetes educator, you have to learn how to critique a paper. Is the research finding valid? That is very important. That's why research is one of the role of diabetes educator. Next slide, please. So, who can be diabetes educator? Does it limit to nurses? No. Diabetes educators can be dietitians, can be pharmacists, can be doctors, can be clinical psychologists, can be exercise physiologists. It can be podiatrists. Podiatrists are those who look after the feet of a person. It can be social worker. It can be physiotherapists. Why? We need all these people. If you look back at AAD 7 cell care days on the left hand side, diabetes involves all these things. Healthy eating that relates to dietitian, being active, exercise physiologist, monitoring, it can be under nurses, pharmacy, dietitian, and so on. Taking medication is pharmacists. Problem solving, clinical psychologists can help, helping coping, and social worker, reducing risk is everybody's job. So, if you are a healthcare provider, you can continue your journey in your profession to be a diabetes educator. Next slide, please. Next slide, please. So the take-home message for today's talk is diabetes is a lifelong disease that can affect many people globally. And I've shared with you the global prevalence and the Malaysian prevalence. Prevalence of diabetes globally and in Malaysia are increasing. Diabetes education are the cornerstone of diabetes management. Without the knowledge, without the skill, without the problem-solving skill, without the correct attitude, with the best medicine in the world, it won't work. Diabetes education are the cornerstone because by providing all this to our patients with diabetes, we aim to improve their cell care, to improve their clinical outcome, to improve their quality of life, to reduce hospitalization rate, to reduce healthcare costs, and most important, to reduce morbidity and mortality. So, as a rule for diabetes educator, we provide knowledge, skills, motivation, and empowerment to the person with diabetes and caregiver to achieve the aims of diabetes management. And diabetes education does not take just 1 hour. In the America, they have done research. In the first year, it takes 10 hours to improve the clinical outcome. And subsequent year is every subsequent years is 2 hours, 2 visits. And it all depends. There is only a general guideline. Some people may need more than that. As Susan Norris, if you remember the meta-analysis, it says that you require 26 hours to reduce 1% of HbA1c. If your patient asks, why do I need to see you so often? Just like you going for your learn how to drive. You don't take just one lesson to learn how to drive. You take many lessons to be a safe driver. So it's the same in diabetes education. And patients meet a lot of challenges as they go on in life. This is where the support comes in. And my last slide, please. Thank you for listening. I hope all of you will be our Malaysian ambassadors for diabetes from today onwards and in the future. Thank you.
That was such a talk from Dr. Tan Ming Yeong. We are truly mesmerized and honored to listen to her inputs. Now, participants are pleased to join the Slido website by clicking the link given in the chat box to ask questions regarding the session, and Dr. Tan Ming Yeong is pleased to answer the question. So there are quite a question there. So the first question is, Doctor, nowadays people usually neglect that they're having diabetes. So other than educating them in terms of knowledge, are there any other ways to bring awareness? Hope that you can answer.
Thank you for the question. It's a very important and practical question. This is where health promotion come in. Ministry of Health is doing a lot for this, and a lot of people think that diabetes are not important because there is no pain, there is no symptom at all. So through education, through Ministry of Health, I know they are doing a lot of promotion, and even in light and easy, mass communication. Are you aware of sometimes you can, over the radio, you hear them talking about taking sugar, should avoid to reduce sugar, and channel like this type of public talk. And we hope even to tap on to religious group, because somehow or other people are sort of pay respect and belief of their religious leader. So I think Ministry of Health is also working towards that also.
Okay, thank you, Doctor. The next question is, greeting, Doctor. What are the pathways that a student need to follow in order to become a diabetes educator in our community?
Again, thank you for a very practical question. Now, there's different level of diabetes educator globally. In Malaysia, currently we have different training. Ministry of Health is providing the advanced diploma and diploma level of training, and then PPUM, UKM are also providing the training, but they are only in diploma and advanced diploma level. And they are usually limited, somehow or other, they are limited to nurses, assistant medical officer, not so much to the pharmacists, the doctors, and the dietitian. But don't worry, we have the last, since 2019, we have another resources for you. There are 2 universities in Malaysia provide postgraduate diploma in diabetes management. University of Warwick and International Medical University, Malaysia. This is where I come from. This is where I teach in the program. Here, our program is open. These 2 universities, their program is open to all healthcare providers. So if you are a pharmacy, you are interested in diabetes care, go ahead, enroll in it. If you are a dietitian, go ahead. If you're a medical doctor, if you're a primary care doctor, go ahead. Warwick has trained a lot of primary care doctors to specialize in diabetes care. And I'm your graduate, we have pharmacy, we have dietitians, so you are still able to achieve it. Of course, you can also enroll the overseas one, like the Australia. A lot of all these are online study now. I hope I answer your question, and most welcome to join the Diabetes Educator group.
Okay, thank you, Doctor. So the next question is, good morning, Doctor. Since diabetes care is by the patient themselves, are there any cases where patient possibly neglect to find which lead to death or danger?
Thank you for your question. In my 35 years of diabetes education journey, I would say yes, and many of them. That's why I would say many of them, I would say some of them. That's why it's not just the knowledge, it's just not the skill, it is the correct attitude. They must have the correct attitude. They want to take care of themselves. They want to improve their clinical outcome. And remember, people with diabetes don't stay by themselves. Family support. That's why diabetes care is very much involved in psychosocial issue, the life that they live, the people that they encounter in their daily life. If they themselves want to take care. But the anak say, "Mak, tak apalah, sikit saja makan kuih." Then you go for a gathering. Everything is there. Then you are trying to move away from all the temptation of good food. Your colleague will say, "Come on, just another drink. It's only 1 cup of Coca-Cola. It won't do you harm." So it happens many times. And in fact, sometimes we have to call in the family to plan for the care for the people with diabetes. And my answer to this question, yes, it has happened before. And some people, in fact, I'm also very actively involved in the Malaysian Diabetes Educator Society. We are coming out with a virtual conference in June this year. And I have a case study which I'm going to invite the clinical psychologist and the dietitian to come in. I call it the case study of engage with the disengage in medical nutritional therapy. Because I have patients asking me, "You are not having diabetes. You don't understand us. If you ask me not to eat all this food, then where is the quality of life?" That's why I say correct attitude is very important. I hope I have answered your question.
I believe that answered well the questions. So we have a new questions. Doctor, I am medical student, but I am interested in dietetic and nutrition. Is it possible for me to be a diabetic counselor or educator after finishing medical school?
Let me read the question again. Is it true that I'm a diabetic? If I'm a diabetic and the food is sugar-free. Okay. We have to define what is sugar-free. A sugar-free can be a carbohydrate. It is the carbohydrate that you have to control. And the types of carbohydrate. If you say sugar-free, rice is sugar-free. It don't taste sweet with rice. But if you eat a mountain of rice, you are going to land up with problem. So it's not just sugar-free. It is carbohydrate. Immediate effect is carbohydrate. And for protein and fat, you will have long-term effect. You have a longer effect on diabetes diabetes, on blood sugar. So it's important to eat a healthy diet. If you're not sure, meet the dietitian. I'm sure UPM also have dietetic division. Meet the dietitian. They will share with you their knowledge and their skill on healthy eating. So not sugar-free, yeah? Thank you for the question.
Okay, doctor. The next question is, doctor, I am a medical student, but I am interested in dietetic and nutrition. Is it possible for me to be a diabetes counselor or educator after finishing medical school?
To be a diabetes educator and counselor, you need to undergo specialized training. This is where, remember, I have a slide talking about the main role of diabetes educator. Yes, you are a medical student. When you graduate, you were still in all diabetes education training to be a diabetes educator. Dietetic and nutrition is part of the curriculum. You will learn that. So you can still be a diabetic counselor educator after finishing your med school. It's possible. That is definitely possible. In fact, in some university, they already start providing you with micro-credentialing on all these subjects already. But definitely possible. And in fact, in Australia, in America, in Europe, a number of the doctors are diabetes educators. After their training as a medical doctor, they continue their journey to learn about the specialized knowledge and skill of diabetes educator. Thank you for the question.
Okay, thank you, doctor. The next question is, as a university student, is it difficult to find time for exercise or sport due to much academical things? So how can I burn my calories and make my body healthy?
Okay, thank you very, very much for this question. It's very practical. I would like to share with you what my patients share with me, especially during the COVID pandemic. You cannot go out, right? Of course, there's different ways of doing. You either get up earlier to exercise. That's what I do. Every morning, I exercise before I go to work, 2 hours of walk, 2 kilometer walk, or you can exercise in between your study. YouTube, my patients share with me so many YouTube programs. Just stop your study for a short while and then relax and go on YouTube and you can exercise at home. These are just my thought of how you can juggle between your study as well as your life with some more physical activity. And of course, I don't know. When we have to try to control our calorie intake, I hope you all are not drinking the soft drink regularly, including 100 plus. I have one patient, 30 years old. Every day he drinks 1.5 liter of sweetened of the soft drink. So guess what is his weight when I saw him? Of course, he was admitted with some infection somewhere where the surgeon referred him to me. His weight when he first saw me was 187 kilo. I talked to him. So we decided we are going to stop all the soft drink. His weight dropped down to 180 kilo. Just like I remember many years ago, the pediatric endocrinologist was saying that if you want to put on weight, just have a can of soft drink every day. After 1 year, I guarantee you'll put on weight. So I hope you all don't indulge with all these sweetened beverages. So to answer again back to your exercise and sport, there are several ways, and they also found that That is for people with diabetes. If every 1 to 2 hours you stop for a while, you do something else, be just moving around and things like that, it improves blood sugar. For you, you can just work into your daily schedule, YouTube or something like that. Or if you just want to go out, just for a walk of 10 minutes, 15 minutes, it may help. Thank you. Thank you for a very important question.
Well, thank you for the great answer, Doctor. Okay, Doctor, we have the last question. Food that are high in quality are very expensive nowadays. How family with financial constraint can buy those food rather than low quality one? Hope that you can
Thank
answer the
you.
question.
Very, very practical question also. First, I would like to ask, what is high in quality food? I hope you are familiar with suku sparrow, the healthy plate. The healthy food are green vegetable. So yes, green vegetable price has gone up, but that is what we are supposed to eat, to take a lot of greens, a lot of high fiber. And whether you can buy just gardenias or Massimos, a whole grain bread, brown rice. They're not very expensive. So you don't have to buy organic food. I don't know. I'm more anti-organic than anything because I think that is not necessary at all. And you don't have to buy the rice in the supermarket they label as for diabetic. No. You only control the portion of your rice. If you can take whole grain, you'll be even better. So you always have to work with family with financial constraint and see what can they afford. And suku sparrow is half of a grain, quarter of carbohydrate, and quarter of meat or protein. So if the fish, chicken are too expensive now, I know cost of living has gone up about 10%. Egg, simple egg. And egg nowadays, the research has shown it doesn't actually increase your cholesterol. You can have egg, you can have tofu, and that can help with the replacement of high expensive protein. I hope I have given you some tips on this.
Okay, thank you, Dr. Tan Ming Yeong, for the priceless information and fantabulous answer. All right, this concludes our Q&A session. Now, let's move to our next agenda, which is presentation of e-certification. As a token of appreciation, we are really honored to present an e-certificate of appreciation to Dr. Tan Ming Yeong for her collaboration in this event. Okay, we move to the photography session. Now, everyone in Streamyard are advised to turn on your camera for there will be a photo session carried out with the speaker. Okay, 3, 2, 1, smile. Okay, thanks all, and thank you, Dr. Tan Ming Yong, for spending your time with us today.
Thank you for having me. Thank you.
Okay, next one. Now, we are very pleased to inform you that Amsa UPM Diabetes Day 2022 has organized an infographic competition in conjunction with Health and Wellness campaign with the theme Surrounding Way to Prevent Diabetes. So, don't forget to join us and participate in the competition. Not to forget, AMSA UPM is also organizing a virtual fun run, which is the perfect opportunity to boost your endurance. All you have to do is track your running progress with tracking apps such as Apple Health, Samsung Health, or Google Fit and sync it to the Book app. For further guidance, do refer to the link provided in the YouTube chat box on how to use the promo codes associated with the Book apps. What are you waiting for? Put your best pair of running shoes to stand a chance to prove to yourself that being fit can prevent diabetes. There's a lot waiting for you. So grab this chance and let's all learn more about diabetes. Okay. Attention to all participants. Now QR code will be projected on the screen for attendance purpose. The post-registration link will also be provided in the chat box of YouTube Live and Streamyard. The QR code will be displayed for 1 minute and the link will be open for 10 minutes only. Thank you. Lastly, thank you very much, Dr. Tan Ming Yeong, for spending your precious time with us today, and thank you to all the attendees for your cooperation. Hope to see you soon.